Morning on Today investigates an inside look at what goes on behind the scenes in the operating room. NBC News partnered with the Center for Public Integrity to tackle what experts think is a growing problem: dirty surgical instruments making their way into surgeons' hands. Dr. Nancy Snyderman is NBC's chief medical editor. Dr. Nancy, good morning.
Good morning, Annie. You know, over the years, as I've walked into surgery in my role as a surgeon and I've asked for an instrument, my assumption has been that everything that's been handed to me is a clean surgical tool. But what I've recently learned is that sometimes that's not the case.
I had to have surgery to repair my shoulder. I was not worried one bit. I knew they were going to take care of me.
Like most patients heading into surgery, John Harrison put his faith and trust in the surgeon standing over him in the operating room. But unknown to most people, including John, surgery doesn't start in the OR. It starts here, in a basement of the hospital where instruments are cleaned, sterilized, and reassembled. But new research shows that too often, surgical tools leave the basement still contaminated with hidden blood, tissue, and other debris, then used to operate on patients like John.
We were told that the recovery time for rotator cuff surgery would be about 6 weeks, and just through physical therapy, his shoulder would be restored.
That didn't happen.
Something was wrong with my shoulder. Something was bad wrong.
2 weeks after the surgery, John's wife Laura rushed him to the hospital where he was told he was infected with a potentially deadly bacteria during his surgery.
It was a nightmare. It was really frightening.
An investigation found that dirty surgical instruments had infected not just John, but 7 patients at the hospital during a 2-week period. And it's happening across the country, with multiple outbreaks reported over the last 2 years. But because only 25 states are required to report surgical site infections, experts worry this is just the tip of the iceberg.
If we do not do our jobs correctly, we can impact a patient's life. That's the reality.
Sharon Green Golden is the head of the sterile processing department at Bon Secours Hospital in Virginia, which is not the hospital where John was treated. She thinks of her team as the unseen patient advocates.
It is a job that cannot be given to robots because the robot doesn't have the critical thinking to say, this is still dirty, I need to clean it some more. Sterile processing is one of the most important jobs in the hospital.
Green Golden has made her sterile processing department state-of-the-art, a model for what should be happening across the country. Yet, she says, in most hospitals, people who are paid to do this work are hourly, minimum wage laborers, and in every state except New Jersey are not required to have any kind of training or certification.
Your hairdresser has to have a license, the barber has a license, the dog groomer has a license, the tattoo artist has a license, and I'm dealing with instruments going in your body. I'm not required to be certified.
Johanna Cizi, a risk management clinical engineer at the University of Michigan Health System, has done eye-opening research that shows even when technicians follow cleaning instructions, oftentimes the instruments still contain debris.
Oh, it's not even an old instrument.
No.
Oh, my gosh. Now you've shocked me. Now you've shocked me. I mean, I would think that that's perfectly fine, and you open it up, and that's pretty horrifying.
Cizi ran a tiny video camera through 350 suction instruments that had been sterilized and deemed ready for the OR.
It looks pigmented. It could easily be blood.
Or rust.
Or rust, but shouldn't be there.
Yes.
Okay.
All contained some kind of debris.
Do you know how many times in my life I've used a suction like this? Thousands.
Aware of the problem, the FDA recently had a meeting where Johanna Cizi presented his data. The FDA requires manufacturers to provide specific cleaning instructions for each surgical instrument, but the testing is done in a laboratory setting and not in the real world. And if a dirty medical device finds its way into an OR, the FDA does not require hospitals to report it. The FDA declined to do an on-camera interview for today, but gave us this statement. Hospitals are reminded to carefully clean and sterilize reusable medical devices. A patient's risk of acquiring an infection from a reprocessed medical device is very low. For John, what was supposed to be a 6-week recovery has turned into a 3-year nightmare.
Changed my life. It changed every aspect of it. Thousands of days of waking up the pain.
A surgery that was supposed to improve his life has led to 7 other surgeries, constant pain, without full use of his arm.
That's what I have to do.
We asked the Advanced Medical Technology Association for a statement, and here's what they said. The medical technology industry is committed to providing patients with safe and effective medical devices and diagnostics. Ensuring the proper reprocessing of reusable medical devices is a shared responsibility between the FDA, device manufacturers, healthcare facilities, and physicians. Now, it is important to point out that this is a relatively rare phenomenon, the idea that you could get an infection going in for a clean surgery. But with the more advanced, complex surgical instruments, the real issue is the cleaning now has become a much more difficult process. And again, I want to thank the Center for Public Integrity because they were a real help with this investigation.
It's very important reporting. You think that they should be certified, the people then who clean these instruments?
There's no reason not to have it certified. You know, we went to the University of Michigan where they have the money in the bowels of the hospital to really have a big reprocessing plant. But as you look at community hospitals where this becomes an expensive process, and then third parties to do it, I think, frankly, this is a shared responsibility where the ball is being dropped. Who pays? The patient pays.
Again, and it comes down
it's
obviously
first
to
do
money.
no harm. At the end of the day, no matter who you are in the medical system, first do no harm.
Dr. Nancy Seidemann, thank you so much.
You bet,
Important
Amy.
reporting this morning.